Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
By the way, Lou, this is a group that we put together actually in 1975. And we've been moving forward ever since. I don't know how you got this one, John.
John was saying he hadn't missed one in 20 years, I think.
Oh, wow. Yeah, that's right. Yeah.
Because Dr. Scantlebury sent me this.
Oh, okay. All right. Okay, well, this is our newsletter that we sent out that talks about, I guess the most important thing is that this was October 1st to October 31st was National Minority Donor Awareness Month. We started this in 1996. And it was then that we thought that National Minority Donor Awareness Day should begin. We began that, and then 12 years later, the Organ Procurement Agency decided that we needed to make it longer. It should be a week, and then in 2019 decided that we should expand it to a month. And so since then, it's been National Minority Donor Awareness Month, and this is something that we've done to try to increase the number of donors. As you know, the number one problem in transplantation is shortage of donors, with 17 people dying every single day because of this donor shortage. And so this is one of the things that we MOTAP began to try to decrease that number of people dying because of the shortage of donors. And then, of course, this newsletter features Bob Chelsea, who was actually the first African-American face transplant recipient. And he celebrates 3 years this year. He's also the oldest face recipient, and he's now 68. So, yeah. So it's interesting, the things that have been done. And then, of course, this is Mona Chapman, who actually celebrated our 25 years of having a MOTAP chapter in Michigan. And she talks about the things she went through and how she's managed to stay on top. She also started the Callender Drew Smith is in its 12th year. And she's a person who just received her doctorate in theology. It was used both to help become very successful. And then this then is a puzzle that was part of the newsletter. Any questions about it, or any part about it you want me to go into depth? Anyway, thank you for putting it. Thank you, Dr. Scantlebury, for sending it to you and putting it on the agenda for us.
Do we have that? Has that been sent? Okay.
Yes, we'll send out.
That's one of the ones he sent out last night.
Yes. Okay.
How many people do you have on the board of MOTAP?
I think 10.
Dr. Callender, can we get their email addresses for our group? Can we add them to our group?
Yeah, I can send it to you. Okay. Now this is a controversial thing. This is an article that talks about Biden reneging on a promise to stick with the provide relief for the Black farmers. And I don't know what some of your thoughts are, but a lot of people felt that he went back on his promise to support this. However, so far, nothing has happened except that the Black farmers are very upset with him. Well, any thoughts about this, about the Black Farmers Relief that was has been discussed and has been part of the legislation? Uh, any thoughts on this? Anybody care anything about this? Because the Black Farmers Association is something that I think actually my daughter worked on a lot of that legislation. They were so thrilled to have it come to pass. They backed Biden's presidency because they felt he would support their program, but in this occasion, he has backed off on it. So Senator Chuck Schumer is trying to restore that, which is
I got a comment, and this is really important because farming is more of a monopoly than anything else. It's run by large corporations. When the white farmers complained of reverse discrimination, what they're really saying is they don't want competition from small farmers. And so it's really not just hurting black farmers, which are typically small farmers, but it's hurting all small farmers because the big farming corporations don't want the competition.
There's a video link here. I don't know if it'll play, but you want to try this video or just
no.
yeah, everybody can click on that when you get your link, and you can watch that video.
Okay.
Yeah, I really didn't know anything about this. You know, there's a lot of money going out from the government to support all kind of people during the pandemic. You know, the renters and the people with mortgages who couldn't pay because they couldn't go to work and things like that. So this has been not on the front page, I don't think, and a lot of people don't know about this.
Yeah, the moratorium on that has expired as well, on the mortgages as well. And that has gotten more attention than this. Okay. Now this is an article that addresses an issue that has long been discussed, and that is that physical activity may have a stronger role in genes and longevity. In terms of genes, a lot of times people think, well, my dad is 90 or something, and so I have the good genes, and so that's all I need. I think, as a matter of fact, Dr. Ivy just had his 90th birthday a short time ago, so he's a good.
No. I've got 91 coming up to Saturday.
Wow. So his children and grandchildren and great grandchildren will say, "Hey, I got good genes. Maybe I don't need to exercise to do those things." But and maybe they don't. But for most of the others of us who don't have those genes, this article compares the presence of those genes and the absence of those genes in people who have over 63 old, 5,446 women, and they found that as you see down, as you go down the article, that the group that exercised had a greater longevity than the group that was not exercising, even though the genes were similar in groups. And so, of course, this just supports something we've talked for decades now, that the minimum exercise of 150 minutes per hour is something that is important to do. Although even if you can't do 150 minutes per week. Any exercise is better than no exercise. Dr. Ivy, any comment on that?
No, I think you're absolutely right. Genes are just a part of it. There are other aspects that contribute to longevity, such as your patterns of health, alcohol, smoking, obesity, all the other attributes that contribute. So genes is just a part of it. It's not the end all. So I agree with this.
Well, you're an expert on it. Daryl, you got anything to add to that? I know you do. So go ahead, Daryl. Let's hear it.
Yeah, I disagree 100. I agree 100%. Exercise is a solution for like many problems.
Okay, and then of course he would add that the proper nutrition is the additive that he is forced upon us for a decade now. And all of the data supports exactly what he says. So, okay.
I would say, good morning, Dr. Callender. I would say, we call it the 5 pillars in wellness. As a wellness coach, I would say it was supported by nutrition, water and nutrition combined together. And then, of course, the exercise and the sleep and the stress, the reduction of the stress, and then making sure that you get enough supplements in your system along with nutrition to complete the full circle.
Right, and I think the element of stress that I like to add to this is the role of meditation, because that's often omitted. In many ways, what you mentioned, stress, brings up the point of the importance of meditation to allow you to de-stress, so to speak.
Well, I think stress is very important as far as one of the negative aspects of wellness. However, meditation and how you handle stress is the factor that determines how effective or ineffective stress is on you.
Yeah.
And so those of us that have certain ways to eliminate pressure from stress could perhaps contribute to others how to avoid it or how to handle it. But everyone has stress, so it's kind of difficult not to be stressed at one point or another. It's just how you manage to handle it.
Especially if you're our complexion.
Yeah,
And,
absolutely.
And of course, it's interesting. I don't need to tell Lou Ivy's whole life story, but Lou was actually the first coronary bypass surgeon at Howard University, and actually helped start the heart surgery program at Howard University. And he's had many opportunities to be stressed. So for him to go through all of that, he actually also started the ICU at Howard University Hospital. So he's been through a lot of stressful circumstances, and here he is at 90, almost 91, talking about it.
Yeah, it's been a fun ride, I tell you.
It's a ride, all right.
Right, you just don't take everything too seriously. You know, you have to have a sort of a temperament about you that is not necessarily highly excitable, and that helps. And it's a building process. It doesn't just come naturally. You just have to work on it.
Well, it's nice to hear your expert opinion on that. Now, this is an article that talks about turning the tide on blood pressure control. And one of the things that bothers me much is the fact that we have a program that goes into the community. And I saw Joyce Winfield Saunders, who has worked along with us. And we've identified that most of the people who are hypertensive are people who are known to be hypertensive, but they don't take their medications. And so this is a group that is leading, but the fact is that we have to have better ways of getting them to monitor and control their blood pressure. And this article pretty much talks about the fact that telehealth and having people take their blood pressures at home and doing it a couple of times a day and ensuring that they take the medication and is probably one of the most important practices you can have. They call it SMBP, but it's self-measured blood pressure. But you know, when we talk about white coat hypertension and those kinds of things, it becomes important for the patients to monitor themselves. You know, when we talk about healthcare, the focal point of healthcare is not the healthcare providers, it's the patients. And so taking this back to the patients and making sure that they are monitoring themselves is an important part of it. And telemedicine does that remotely and therefore allows them to be factored into this. We had a program like this for hypertension in which we had people go into the houses and had the grandchildren educate the parents in terms of how to do a lot of this. And I think this is really one of the best ways to improve hypertension, which is one of the biggest killers. Cardiovascular disease is the #1 killer in this country and the world. So I think that this is a program that needs to be stressed, more stressed, the better.
I think one example of this failure to take medications is exemplified in this John Fetterman, who's running for Senate in Pennsylvania. This is a big white guy who has not been taking his medicines, and he had a stroke as a result, which is a complication of hypertension. And he has admitted that he did not take his medications, and now he's about to take them. Now, you know, we as Blacks have more propensity for hypertension because of the increased salt intake or how we handle the salt that we do take in. And those are all factors in contributing to hypertension, but the medication control is very important. And again, another aspect is that we as Blacks many times don't have the proper medication started at the appropriate time because we seek medical care later or not at all. So that too is an issue.
So doctors, I wondered about that. You know, you said people had prescriptions but didn't take the medicine. Why were people not taking their blood pressure medicine?
It's a silent killer. You don't feel necessarily the ill effects of not taking your medication until you get dizzy or pass out or have some catastrophic event. That's one reason they don't take the medication.
You're right, and there's a number of reasons, but if they took their blood pressure and did self-monitoring, they'd be more aware of it because, as you said, there's no symptoms of hypertension until it gets out of control. An interesting side bit is that Samuel Kuntz, the first African-American transplant surgeon in the world, actually died of complications of hypertension. Most people don't realize that because the newspaper said he died of some virus he picked up in Africa, but that's not true. The truth of the matter is he had uncontrolled hypertension, went to the hospital and they gave him medication to control it. He has a seizure, became anoxic, and eventually died. So the consequence of not taking the blood pressure medicine and succumbing from its complications are prolific all around us.
One thing that I found out in working with clients is when I work with them, it has to be a holistic approach because they have to tell me what each provider is doing for them in order to have a complete wellness plan, create a complete wellness plan. And one of the reasons when I honestly asked, what is your last reading? This morning and in the PM. And I said, did you take your medicine? And a lot of them would say it's because of the side effects. And I would say, you need to go back to the doctor and discuss, ask for a consultation and discuss with him the side effects you're having. Because some people, the side effects affects them very, very harshly in their body.
Right, and it's interesting that you would say that, because one of the things we've learned through the decades, Lou knows this as well as I do, because we came up in a time when they only had 2, 3, or 4 antihypertensive medications. Now they must have about 30 of them. So if you've got side effects, all you have to do, as you said, is to share that with your doctor and get on one of the blood pressure medicines that doesn't cause that side effect.
That's
But if you don't communicate that with your doctor, then it's not going to be taken care of. And one of the commonest side effects, especially for men, is impotence, the inability to have an erection. And so some men are afraid to discuss it with their physicians. And so this then is another reason why. And it's killed many men. Many men would rather die than take blood pressure medicine and lose the ability to have an erection.
Yeah, Dr. Callender, I had the effect of dizziness. When I would stand up, I would get dizzy, lightheaded, and my doctor had to adjust my medication. I was on atenolol only, and then they gave me another one. And since the change in meds, I haven't had that dizzy feeling.
What metformin? I don't know. Dr. Callender, I just had my yearly exam from my primary care doctor. And you know, when you always go to the doctor, they weigh you and take your pressure. And my pressure was up. And so when the doctor came in, she asked me why. She looked at my chart and saw that I used to take medication, but she hadn't prescribed it lately. So I told her that usually when I come out or walk or whatever, my pressure goes up. But she said, well, I'll take it again before you leave. And of course, when she took it, it was down after I had been there and settled down for a while. So what she said is just what this article is saying, that Betty, you need to monitor yourself. Take it at home and we'll see if it's relatively stable, then maybe you don't need the medication. But you need to take it on a regular basis to see how it is doing. So that's what I've decided to do.
Very good point, because white coat hypertension is a situation where when you go to the doctor, your blood pressure is up. But when you're at home and everything else is okay, your blood pressure is normal. And as you mentioned, that's the best way to find out. So take your pressure yourself at home where you're relaxed. Because when you go to the doctor, you're excited. You have to rush, be on time, and those kind of things. And so the best way to address that is by this kind of program, as you mentioned. And you might think, why would we spend so much time on this? Because hypertension kills, that's why. Okay, next one is
Dr. Callender, I'm sorry I was on mute, but one of the things, I'm also the white coat patient. When I go in, my blood pressure is elevated, and when I'm home, it's just fine. And what my doctor had recommended that I do was to bring my blood pressure machine in so that they can check it to make sure that it's in agreement with what the ratings that they get and the ratings that I get. And when I did that, they were consistent. His machine was consistent with my machine. So that made him feel more at ease with my blood pressure elevated when I'm there and when it's not elevated at home.
okay. This is an interesting article for those of us who are approaching because they have a new category, and that's the super elderly, which is above 85. And this article about zombie cells is an interesting article because it talks about the fact that telomeres and other things that are associated with aging are a consequence of what they call zombie cells. These are cells that aren't thriving and they're not as active, and they harm other cells that they touch. And they're like zombies. They aren't dead, but they're not alive either. They're not active. They think that the senescence, which is the term for aging, is contributed to by these cells. And I think they talk about this gentleman who's 95, I think, who is running all over the place in his own place, and there's a suggestion that while we are looking for the fountain of youth, while we say we're not, we are, and I guess one of the ways we demonstrate that is by organ transplantation, because as you get older, you get a transplant, try to live longer and longer. But this is a scientist who is vital at 94, and he's still a professor of anatomy, speaks and writes. He also feels that there are that it's not accurate that normal cells could replicate forever, but he says that there are things we do that will cause these ghost cells to go away, because as cells, the way you live is that cells rapidly divide and replenish themselves, and as you get older, the cells don't divide and the telomeres shorten, and this then winds up in your death. And so one of the things that they're suggesting is that many of the things we do that we talked about, the activity gets rid of those bad cells by apoptosis or programmed cell death, and it gets the active cells to continue to divide and replicate themselves. But this is a topic that so far there have been some compounds I've seen some literature on, in which 50% of the aging cells were medicated and were made to start dividing again. And so that down the road, there may be some of these cells that wake up these ghost cells and allow the telomeres to lengthen and cells to divide again and to restore their youth. So that this is a real topic for great discussion. And the question though is, why is it that this guy at 94 is able to do this, and many others? You know, it's interesting, as you reach the ages of 60, you see so many people who are no longer able to get around for one reason or another, and yet there's exceptions to the rules. Those people who are able to, like this guy, 81, installed a track, and so he's throwing a discus, as well as the others who have running track. So, and then of course the other thing is, this guy tore his hamstring, so he couldn't run track. So he started running again after turning 50, and so he has now continues to do this. And this then, of course, we know about John Tatum's father, who died at a little short of his 102nd birthday, who was competing in swimming exercises for virtually all of his later life. Any comments on this subject, which is a topic that is going to be talked about and researched as long as man is alive? No other comments?
It
Okay.
just says you need to exercise. That's what it preaches to me.
Yeah.
You need to move.
Yeah, I have one of my nieces. That's her. That's what she says. Keep moving. Keep moving. Keep dancing. Is what she says. Keep dancing. Now, this is no surprise to us that COVID has driven down the life expectancy for the second straight year. We're down to 77. It used to be up to close to 80. Now it's all down to 77. And this is primarily because of the pandemic that has really hurt us badly. And it's actually it's interesting to note that August the 2nd we had nearly 1,000 deaths in one day. So that the pandemic is still with us, although it's not. It's hurting those people who are not vaccinated because they require hospitalization and death. But it's still hurting, and so we expect that unless something else happens, life expectancy will continue to rise as long as we still have unvaccinated patients. And I think the most recent study said that about 46% of the country has been fully immunized, which is a low figure. Now that belies the fact that about 70% of the people have had at least one shot. But there, in terms of people who received the second shot and the booster shot, only about 50% of the population has received that.
Dr. Callender, I just heard yesterday that they recommend, CDC is recommending that you don't skip your two basic shots before you get a booster. Some people are saying, well, I'm not going to get the first two. I'm just going to go get the booster. They don't recommend that.
That's not smart. No, that makes no sense for anybody to do that. And it also makes no sense for those who's had the first two shots not to get a booster shot whenever they can, especially if they're high risk, because within 4 to 6 months of receiving the last booster shot, you become susceptible. So,
Dr. Callender, that makes sense to me also, because if you don't get those first two shots, then what are you boosting?
nicely put, John. It's a positive spin on what's happened with this deadly virus, which has killed so many people. And it talks about the many things that we've gotten as a consequence. We spent billions of dollars on COVID-19 research, but we have actually got a lot of positive things out of it. First is the fact that mRNA vaccines, which had not been used before in this way, has emphasized how important using mRNA rather than DNA. And this then has been one of the things that has been extremely successful. One of the things is that it's demonstrated that the immune response is very wonderful from the mRNA vaccines, and maybe even better than some of the DNA vaccines. And so they're using this to make other vaccines RNA, which were previously DNA. Now, we also identified, for example, I've mentioned this previously, that there are antibodies against our own antibodies. For example, interferon. It's been clear that many of the people who die from COVID have antibody against interferon, which protects against the coronavirus infection. And these antibodies may require competitive inhibition antibodies that knock out these antibodies and allow the interferon to do its work. Because we've identified that in many of the people who died, they have this autoantibody that prevents the interferon from doing its work. And so an antibody that knocks out this antibody by competitive inhibition would be one of the ways that you can fight off coronavirus and also fight off the flu itself. And so that this is something that helps your immune system and helps you to deal with other viral infections. Now, one of the things that also we've been reminded is that masking and hand washing works. And this works not only for COVID virus, but also for the flu. And so we are learning that those simple things make a difference. Also, improving ventilation. We know that the air in the room is completely replaced at least 4 times an hour will make a big difference. This is something that we've always known, but never put into practice so much. And I think that building your immune system is something that is part and parcel of survival, and it's contributed to by many of the things that we already discussed. And she mentioned the 5 pillars, and all of those are helpful in terms of maintaining your immunity.
Dr. Callender, with all the monies and the research done with the COVID-19, has anything led to any breakthroughs in dementia and cancer?
Yeah, and cancer, yes, but not dementia.
Mm-hmm.
Yeah, cancer, yes, because some of these antibodies that they're talking about can be used for cancer, but nothing has helped so far in terms of dementia.
Mm. Thank you.
Well, I think the fact that there are going to be new COVID boosters, and there's an article that we have in here that talks about the FDA authorizing the new booster shots. There's an article on that. And Labor Day is just Monday, so it's right around the corner. How right around the corner it is will be demonstrated after Monday, because that's the day in which they are supposed to become available. We shall see. And this is what's different about these booster shots is that they are targeting the BA.4 or 5 that have not been targeted in the past. And these are the ones that have really taken over, causing so many hospitalizations and even deaths, even now. So it's kind of hard to talk about the pandemic being over when you have so many people who recently infected and dying from the COVID virus. So I think the importance is that those people who are not vaccinated need to be vaccinated, and those people who have not gotten boosters need to get boosters. As you can see, it's BA.5 is responsible for about 88% of all the new cases. And then of course, as we know, there will be variants coming even after that. So we just have to continue to get boosted up and And that's going to be the key to survival. Now, some people are expecting, Lou, you want to say something?
I started to say that it's been pointed out that COVID's going to be with us forever. So it's a question of not curing it or getting rid of it. We just have to prepare and update our immunization as it becomes available to ward off future deaths. But those that are vaccinated and boosted at least have a better chance of not dying other than just getting sick, which is a big help.
Okay. And I think the health, what is kind of scary though, is that people are acting as though the vaccine, that the virus is gone.
Mm-hmm.
What you say is very true, but our behavior is not like that. Our behavior is like the pandemic is over and we don't have to worry about it. So, and that's what is more deadly than anything else, perhaps.
Mm-hmm.
Some are expecting that the flu will manifest itself this year, but that would occur if we forget about the lessons we've learned from COVID in terms of masking and hand washing and social distancing.
Mm-hmm.
I had a question, Doc. Do you blame the government for wiping out the infrastructure that we had to prevent pandemics that President Obama had in place before that next president came in? Because I definitely,
I'm not about blaming. I'm about addressing what we can do to deal with what we have. We all make mistakes, and Trump made his. But blaming to me is, I'm beyond that. I'm in the today, and let's address what we have and forget about what they didn't do that they should have done. That's my position on it.
do you think that we have reestablished that infrastructure since?
Time will tell. Time will tell. It's hard to say because we haven't addressed. We still have homelessness. We still have healthcare not provided for all Americans. So until we have that, I don't think we have the infrastructure. The infrastructure is that we have equitable allocation of health resources to all Americans, which we do not have. We've never had that infrastructure. We're the only fully developed country that doesn't have healthcare as a right for all Americans. So my answer is no, we're not ready. Other opinions on it, so don't let my opinion be the only one. Lou, what are your thoughts?
No, I agree wholeheartedly with your opinion there. I don't think the infrastructure has really deteriorated. I think it's being rebuilt. It can always be improved. And so we can't stop with what we had and looking back in the past. We just have to go forward and improve on what we had. And until we reach the point that Dr. Callender has pointed out, equity for healthcare for all is going to be our limits.
Any other thoughts?
I don't think the equity is going to come in my lifetime.
Can always look
You never
forward.
know. You never know. Uh, I think this is good news that we got getting these boosters right around Labor Day, so that let's see what
Yeah.
we have. It's a start, you know. So and so this is a promissory note that we're looking forward to seeing that we get it up. Although some people are still bothered by the fact that Pfizer is making so much money off of it. But you know, this is a capitalistic country, and we thrive on that kind of stuff. And as long as we're capitalistic, that's what drives us. Pfizer and Moderna may battle over it, but they're both making billions.
Dr. Callender, do you think, I'm thinking about what you said, the RNA, the new, the COVID vaccines, RNA, where it used to be the old ones were DNA.
Yes.
I'm wondering if the RNA vaccines used so far have only been successful for 4 to 6 months, where the other DNAs were, you know, flu shots for a year. So do you think the differences in how they were made makes a difference in that?
No, I think the difference is the virus itself.
Oh, okay.
And this virus is different from the other viruses.
Okay.
That this virus is continually having variations on a theme, and these variants are the problem. I
Okay.
don't think it's the RNA, but time will tell, because you know one of the vaccines is DNA. Can't think of the name of it now. It came out last.
Johnson or Novavax?
No, Novavax.
No.
Novavax is DNA based.
Oh, okay.
Yeah, and so we have both on the market. So with time, we'll get the answer on that question that you raised, which is an important one. But most people believe it's the fact that these viruses are is more of a has more variants than any other one that we've had so far. But time will tell that to get the answer on that. Sometimes what we think is the answer is not the real answer, but time will tell.
Dr. Callender, is it still recommended to take the flu shot and the COVID vaccine booster at the same time?
It's not recommended, but you can. Nobody knows the answer to that question, but nobody is saying it's problematic to do it or not to do it. You just need to have both. Whether you get them together or not is so far is optional, and nobody recommends for or against it.
Thank you.
You got any thoughts on that?
No, I think that's right. It's just so long as you get them both, the time hasn't been a factor so far.
Well, this is Fauci saying what actually Dr. Ivy had said, that we're not going to eradicate the virus. Let's hope he's wrong. Evidence suggests that he's right. And so in the meantime, anyway.
We thought we had done that with polio, but we see polio's coming back.
Yeah, of course. Yeah. So.
Dr. Callender, it's very unlikely that you can go to a healthcare facility and have 2 appointments, one for the flu and one for the virus. You know, it seems to me there's always, you have to schedule separate appointments.
Well, I don't know. That depends on the doctor you go to.
That's not true, John. The pharmacist asked me if I wanted to get both my booster and my flu shot at the same time. And I said yes, but when the doctor actually came he suggested, he said it, I could, but he suggested that it might be better if you take one and come back a couple of days later and get the other one.
Yeah, and that makes sense because you don't know how the first one is going to react.
But there's no data to back up either position.
Precaution would be to wait and see how one would affect you first.
You know, so far I've gotten them all and they haven't affected me, except keeping me healthy, I hope.
What is really interesting to behold is what happens in the schools. That is really unclear in terms of what the impact opening schools. Of course, we all read in newspapers how badly our students are doing on tests. So we know that school is important. And the fact that the time they spent home allegedly learning, and the reason I say allegedly is because a lot of those videos were turned off. So you don't know whether they were there or not. And the way they're doing on tests, it suggests they weren't there. And so the education process is something that we really need to spend a lot of time increasing the salaries of teachers so that we have teachers who can raise up the education level of our students. That's, you know, it's embarrassing to see how our students do in comparison to students from other countries. I think we've got a long way to go to recognize we preach that the students of today are the leaders of tomorrow, but we don't act like that in terms of the way we pay our teachers and the way we incentivize our teachers. Now we got a lot of retired teachers on this this meeting, so any of you want to make some comments?
Yes, they are satisfied. They aren't saying anything.
Well, there are several variables. Yes, higher salary that deems the work that we have and we are doing. Another thing is staffing. And the other thing is small class size. And because we now have technology, there need to be a resource to back technology. Most time what happens is when things changes, everything falls on that one person. And that one person either work 14 hours a day or they work that minimum. And it depends on the mindset of the teacher and what they want to accomplish. So it's a lot of variables in there.
Well, that just says that the system is faulty and that the system needs to be changed. Because for us to have a system that relies on one or two people is problematic. And I'm amazed at the number of retired teachers who are in this group are not making any comment, because it's not the single teacher, it's the system that you put in place that is at fault.
Dr. Callender, I believe that it's a problem in our American society in general. Other countries, especially the Asian countries, revere the elders and revere the teachers. They're held in high regard and they're paid very, very well. So I think this is part of it. You know, as a teacher, I mean, I struggled for a long time. You know, especially starting off, low salary. I mean, I was teaching 30 years before I got to six figures, and that, to me, that's it shows that we don't hold teachers in high regard. So that's just my opinion.
I would like to say this point. The salary, John Buchanan, we'll talk later about which system you were in that got 6 figures. But with the racial disparity of holding teachers accountable, there's more pressure on teachers than ever before. With the mainstreaming, they're acting like a teacher is responsible for educating the whole masses where other countries are not. For instance, we no longer give the tests as far as IQs and etc. But everyone knows that children have learning levels. There are still children, and it's not politically it's correct to say that there are morons. There are children that are mentally retarded, but yet they're still mainstream, and a teacher is held accountable and their paycheck is held accountable whether or not they teach this child with low mental abilities as well as the child that has a high IQ and can learn faster. In some countries, like even at England, there is a privilege of going up to high school and even college, and they have to take tests and etc. But in America, I have a relative, for instance, who did have a low ability, special ed, and America says that he had the right to attend college and he couldn't get in a private college or anything. And they took his money knowing that he did not have the capabilities of graduating. Teachers, they can no longer discipline. They cannot even do the formal. They have gotten their hands tied, but yet they say that, especially like in PG and DC, that everyone is college, career, everyone will go to college. And if you're a parent, you know that your children don't have all the same capabilities. America is really destroying itself as far as educational and being realistic about the whole thing. And yet a teacher's salary is tied into whether or not that child passes a test to go further. So the whole system is faulty and we're doing it to ourselves. And I did a paper on that about mainstreaming, and they're doing this racially and trying to figure out how come we don't do it for Yale or any other system. We only do it in the public school system and wondering why it's failing. So it's a long dissertation on that. But our educational system, it's not that we have worse teachers, we're just setting up more parameters for our failure.
And that's so true. I have a niece who's a teacher, and she taught for 10 years in a private school in PG County. And it wasn't much money into it. And last year she started public school in PG County. She got the money, but she said it's not satisfying because of the level of teaching. She was teaching third graders and kindergarten kids. Now they barely know an alphabet. They cannot count. And she said it's very disheartening. And she's given it her all. She has a student this year. She believes there's a true learning disability. And she's talked to the principal, but PG County, I think, Carol, she said, has a ruling that you must work with the student or have the student in the class for 30 days before they can do anything to remove the student. But in the meantime, the students are afraid of this one student who constantly is running around, banging her head. And she said it's a whole different learning system from the private school to the public school. And she felt in the beginning that she was failing. And she now realizes that she is able to push these kids further ahead than some of her counterparts, some of the existing teachers that were in this public school. But how do you teach when you know you have this one disruptive child who constantly brings the others down?
I had one autistic child in music, and the pitch, any pitches that like shh or a certain sound would set off their nervous central system, but yet the county says that they have to be mainstream. They're supposed to have a test and an IEP and a conference with the teacher, but when you have a class of 40, you do not have time to meet. And then special ed teachers no longer have to keep them there together because that's segregating the children. They got to be mainstreamed into your classroom, whether or not. The whole system, if you go into that, I felt sorry. I've had autistic children and I didn't even know I had them until later. They said, oh, they were autistic. And then they didn't tell me what autistic level of autism they had and etc. or some physical defect. I had one child named Pancreas who was legally blind and deaf, mainstreamed in my classroom because his parent did not want him segregated from normal children. And I did not have the tools to teach a blind, deaf child, but that's America.
I have a very different view of on this issue. I guess because we in America, we don't know how blessed we are. In the place I come from, in Nigeria as a whole, and in some African countries, teachers are the least paid. A teacher makes, on top of the scale, $83 per month. A college professor, a university professor, makes, on top of the scale, $900 a month.
Wow.
So you can see that we are blessed here. The cost of living may not be the same, but almost equal. The cost of living is high in every part of the world, now. So we are blessed. The support system we have, because I've taught in America here as a professor of genetics at Howard, and as a science teacher in the public school. The support system here is far greater than you have in most African countries, So all in all, we are very, very blessed, except you have traveled out from America and stayed somewhere in amongst the third world countries and worked there or taught there, then you will realize what I'm saying, that we should be thankful of what we have.
Thank you for your opinions. That's good. Yeah. The next article is on unvaccinated cadets ordered off the academy campus. It's interesting how the vaccination mandate fits into this. Unless you have, and in this situation, the religious exemptions were denied. And of course, we just talked last week about the fact that the court had required those people who lost their jobs because they didn't take the vaccination because of religious reasons. They said that this is illegal, and therefore, so it's interesting to see that in this academy, regardless of request for religious exemptions, they were put out of school. So it's kind of interesting to see what will happen, what the courts will do about this matter as well.
But that's the Department of Defense decision. Lloyd Austin agreed that all military, be they academy or active duty personnel, have to be vaccinated to be on duty. Those that have refused have been discharged in most instances. Very few religious objections, very few.
Yeah. I wonder which ones they accept. It's amazing. Yeah. So once the defense secretary says that, that's the law then, right?
That's the law, but he didn't make it himself. That's the government. The Defense Department in its entirety decided that should be it for the U.S. government. And Austin was just the spokesman for it, but that's the policy in U.S. government.
Wow. Okay, well, that's interesting. We'll watch and see what happens with this one. Now, this is an article I thought was interesting to put in here because how social media is still contributing to vaccine hesitancy in the United States. You know, you think by now that everybody would know better. But in point of fact, as they compare United States to the rest of the world, they look at the number of people who are vaccinated, the number of people who are not vaccinated. And they think that a lot of it is related, as actually Darrell has said many times, to the power of social media. And whether it's accurate or not, people believe what they see in social media. And this is particularly true in those under the age of 25 who use Twitter and other things like that. It says 2/3 of people use Instagram, and more likely to read news on social media than other things. So the point is that we compare our rates of hesitancy. Go back up, please. No, go back up. Yeah, look at the comparison. Nigeria, Russia, Nigeria, South America. And this, of course, is showing that our hesitancy had increased, which is a sad commentary. So we're surrounded by truth, but we choose to believe what the social media says. And so question is, what can you do about it? And that remains the question. How do we use social media to educate rather than to de-educate or provide myths rather than substance? And the rumors persist, even though the data indicates that much of the rumors are not true. But people continue to accept the myths rather than accept the truth. So how do you do that? How do you deal with that?
Dr. Callender, I just heard that the new booster that's out, it was not tested on humans, but only on mice.
That's the rumor. Huh? Okay. And so that's the kind of thing that goes on the social media, whether it's true or not. And so that's what we have to battle against.
That's why you have the FDA as a source for authentication as to whether or not it's acceptable or not, rather than the rumor mill.
Yeah. Well, that's freedom of speech, I guess. You know, because it's relative. Of course, the athletes have no freedom of speech. They speak up, they get fined. But
that's by their employer, you know.
Right.
It's private industry.
Yeah. Any comment about the social media? Any other comments about that? If not, we go into the Moderna and Pfizer battling over the patents that accusing its competitors of copying their technology, and the battle of technology and fighting each other for who has the rights is something that has gone on from time immemorial, and there's no change today. So it'll be interesting what the courts decide. As they battle, we'll just wait and see. And of course, it is true that mRNA technology is old, but the application of it to the vaccine is what is new. And so it's going to be interesting to see how this works out. Is this any of our business? I'm not sure, but anyway, it's kind of interesting. Can you imagine such amounts, 33 billion in 1 year? Amazing. Wow. Of course, when you look at the oil industry, the Saudi Arabians made $88 billion in one 6-month period of time. So everything is relative. Now, this is just for those who aren't clear about monkeypox, that direct contact is the main transmission route, although there are other possibilities. And there's been a lot of discussion, even discussion about the fact that male-to-male sex has been the major source of this infection. And so this has caused a lot of controversy and discussion, but the fact that this is a sexually transmitted disease remains a fact. And the fact that contact is the major way that it is transmitted.
And that's based on the fact that that is the most highly affected population.
Right.
So rather than just saying gay people are the only victims, they just happen to be the ones who are most affected at this point, and due to the direct contact, skin to skin, and other body fluids contributes to that. But they're not unique, aside from that.
Yeah. Any other thoughts about this? I remember Dr. Eto had made some comments about it in the past.
Dr. Callender, to refresh our memory, this originated from where?
It originated initially from the Congo.
Okay, and that's because they were had contact with monkeys?
Yes.
Okay.
Because this is an old disease, it's not new. Old meaning within the last 5 to 10 years. Not like coronavirus, which is new.
Mm-hmm.
Dr. Callender, you compared this with AIDS as far as the transmission route.
Yeah, well, it's interesting because HIV started off the same way with first the men who had sex with men being the primary targets, and then of course men who had sex with men had sex with women, and so it became heterosexual as well as homosexual. That's how HIV was. That similarity remains, but the difference is that this sticks to contact transmission. What changed was that you have drugs, infected needles, and so forth and so on, that led to HIV just infecting a lot of different people, without sex being the only transmission source.
I thought you made a comparison with it being xenographic.
Being what?
Xenotransmission. You remember I thought you said AIDS came from
There's no question. AIDS came from the primate model, yes. It's just that this is the monkey. That's the difference. They both are xenotransplants. Xenosis is the term that we use when you have a virus that comes from one species to another. And they both are xenosis.
Thank you.
Okay, my question is, um, are you saying that this originated with human sexual contact with monkeys?
No, just saying it eliminated, it came from monkeys, just like the HIV came from the ape primate model, apes. So no, I'm not saying sex had anything to do with the origin of it. I'm saying that its transmission in humans is related to sexual. Not saying that anybody had sex with the monkeys or apes.
Okay, so this is just transmitted from humans being around monkeys.
Right, that's correct. Now, I never understood why monkeypox was considered racist. Anybody understand why?
Yeah, because for years they tried to say that black people are monkey. We've been called monkeys.
Yeah, but that doesn't make us monkeys.
No.
They also said we had tails.
Right. Yeah, I was accused of that in college.
What? My goodness.
Yeah. Guy asked me if I had a tail. One of my college classmates. Boy,
You should have told him, yeah, I have a T-A-L-E, yeah, I have a tail.
Well, I had an incident, not reference to tail, but I had an incident when I was at University of Iowa. We were at a party, and one guy walked up to me and touched my skin. At that time, I wore makeup every day. He touched my skin. And when he touched my face, I said, don't touch my face. And he got makeup on his hand. I said, you got to be careful, it'll rub off on you. He was frightened.
Well, I had that too. I was in the bus, and this little kid came up to see if my face color would rub off. So in New York, we had it all.
Yeah, we had our own way of dealing with racism, and that was my way.
Yeah. It's amazing the thing we.
But getting back to the monkey and the tail, I love YouTube. Okay, so I'm a YouTube University student, and I noticed that in certain countries that they're bringing monkeys into their homes, baby monkeys, and they when they give them a bath, they wash the babies with their hands, the baby monkeys with their hands, and they go to all parts of the body. And they take that shampoo and they wash the whole body of the baby monkey, including that area. Okay. And so, when we as teachers did the science experiment that I did during the flu season was to do the experiment of raisins and how germ progress in the classroom. And so when I look at going back to them bringing the monkeys into their homes and bathing them with their bare hands, I can see transmission, okay? And the other one that I just saw last night was where in one country, there are so many monkeys now that they're sterilizing the female monkeys.
Wow. Amazing. Wow. I didn't realize that the monkeys had become a big pet all over the world.
In India, especially.
Yes. And they're teaching them to go to school. They're teaching them how to do things in their home for them. It's almost, well, anyway, I'll leave that alone.
Please.
Any other comments on this interesting disease that I think there's another article on the first death from monkeypox.
The only other thing I would say about it is, if you all think that the name is racist, I don't think it is. I think there is no other name that you can really call that.
It's from a monkey, so, well, we'll see. They're trying to come up with another name, so we'll see. And this reports the first death died in monkeypox in the United States. And it's interesting that it happened in an immunocompromised patient. Of course, immunocompromised can be a number of ways, from HIV, from medication, or from a lot of different things that they haven't identified, but the total global death toll is 16. That's amazing. It's very small, but for global, right? Yeah.
Well, I've got a name for you. Call it lower primate pox, or LPP.
Well, they may come up with something like that. Yeah. Well, we'll see. They're suggesting that anybody has any skin problems to get tested. This is an interesting article that I included because herbal remedies often do not tell you exactly what's in the herbal medication. And this is a herbal medication that this wife of this representative used, and it killed her. And they white mulberry leaf ingestion is what they said they found in her stomach. Whether she had the tea leaves or whatever, but the partially intact leaf was found in her stomach. And herbal remedies have really grown. And I think the only thing that is important, I think that as you had mentioned earlier, that the holistic approach is so important to know exactly what your patients, clients are on, because if they're on herbal medicine, you need to know exactly what herbal medicine it is. And I believe that the holistic practice of medicine is the only way to practice, and that you should know if they're on products. They should tell you and let you know, so you can research it with them and see whether it's safe or not. Because it's not that herbal products. There are some that are good and there's some that aren't. So you need to know exactly what's in it before you recommend it. And if your patients are on it, they need to be sure to ask them about it, that you know what they're on. The sad way to come home, find your wife dead, huh? And it's a herbal product that somebody had recommended to help her diabetes. So. Sad story, but it's something that we can use to help us be conscious of all of the things that we take. Sometimes we know about them. If we don't know about them, then we should make sure that you read the labels and check with your doctor to see if it's compatible with the other medications that you're taking. Many patients don't tell you about their herbal medications because they think you would be opposed to it. And I think it's important to have full disclosure so that you can be as helpful to the patient as you can. Somebody had suggested that the flu is going to bounce back this year. I would think that if we followed the same rules that we followed for the management of coronavirus, we would have decreased flu deaths. But we shall see. This is apparently in Minnesota. There's a turkey flock that has been associated with the flu that has been resulted in highly pathogenic situation. So this has killed a lot of birds, and is concerned that it could spread to us. Right now, it's it really affects humans, so it's not but it's killing a lot of birds. So the fear is that it might spread to humans with the xenozoonosis that we talked about earlier. There's a funny article because in New York State, they outlawed whipped cream, whipped cartridges, because they had nitrous oxide, which is laughing gas, what gets people high. And so when they outlawed that, they didn't realize that whipped cream has the same kind of canister. So because like you wonder, why would you legislate against whipped cream? Man, the intent was not to do it against whipped cream. It's just that nitrous oxide was in the same kind of cartridge. Well, let's not. Anybody know anything about Ready Whip and
I have some in my refrigerator.
yeah, okay.
It's good. I use it with my fruit.
Okay. And Darryl will be excited to hear about that. Okay, next one.
That's it, Doc.
Okay. Any other comments? Glad to see so many of you back with us today, and we're excited that we had Dr. Ivy with us today, and actually had Chris for the whole session, believe it or not. How about that?